Kept gaining weight. The more I tried to lose weight, the more weight I gained, no matter what I did. And I was on blood pressure medicine. I was taking two pills for my sugar to try to lower it. And even then it didn't keep it down as much as I wanted it to. And the doctor told me eventually I would be on the shot.
Okay. And so where were your sugars that you remember the highest, and where were they before you came here?
My highest were over 200, but
Okay.
very rarely, but still they were over 200.
Okay.
And which I did not like. So I, when I saw this on TV, I said, the first time I saw it, I thought about it. The second, my sister called me and said, "Oh, I saw this on TV." I said, "Yeah, I saw it." So she got the phone number, and that's when I called.
Okay.
So
Now, the first time when you were here, when you started to learn about what we do here, did it make sense to you?
oh yeah,
Okay.
and the biggest thing was I did not realize is that diabetes just keeps getting worse. You don't just because you're taking a pill does not mean that your body, you're going to get better. You're
Right.
not going to get better. You're just going to steadily get worse.
Right. And what were you fearful of getting worse?
Oh, I didn't want to go on the shots.
Yeah.
I have a grandson that's type 1 diabetic. So I know,
Yeah.
with the shots. So
Okay.
I had a grandmother that was on the shots
Right.
as long as I, knew her. So
Yeah. So where are you now? What are some of the most noticeable things that you can say have gotten better, improved?
okay, I'm not taking a blood pressure medicine anymore,
Awesome.
which is fantastic. I'm down to 1 pill in the morning. That's it. Not at night, because I kept bottom out.
Good. Good.
I've lost a lot of weight,
How much weight?
28 pounds.
Good. Very good.
So, and that's in a short length of time, I believe, I think.
How long have you been under care here?
What was it, 2.5 months?
Yeah. So,
And I noticed that, I lost weight right away.
did you exercise a lot to lose that weight?
I don't exercise very much. I am thinking about exercising to get toned up,
Yes.
because now I'm losing the weight, I just gotta tone it up. I'm not a young person anymore,
But
so.
all of your forward progress, though, was without exercise.
Without exercise.
Exactly.
And I know with diabetes, exercise is good,
Right.
because it does lower your sugars.
Yeah. And how much would you say you've learned since being here about yourself and about?
Oh. I know there's a lot of things I can't eat that I used to eat,
Yeah.
and other things that I have to eat in moderation. Not get excessive.
Now, what would you say if somebody was sitting here next to you and just like you said, you talked to somebody out in the waiting room, somebody that just, is in disarray health-wise and doesn't think that there's any way that they can get better, what would you say to them about?
Oh, I would tell them that this is an excellent program, that it does work. Of course, it takes willpower. You have to have willpower and be determined that this is what you want. But yeah, it's an excellent program. I would recommend it if they hadn't started out on it.
Wonderful.
So.
Anything else?
I don't think so. I
Okay,
think that's
good.
it.